Hello everyone, I'm Dr. Neto Pignataro, and I would like to take a moment to express my gratitude to the event organization for the opportunity of sharing with you all another lecture at the Science, Information and Spirit Congress, in which I will discuss microsystems, teeth and their organ relationships, and also about the scientific perspectives. Last year we did a presentation of the dental tab in the BioWell system that we worked on with Dmitry Orlov, so that we could relate the energy levels of teeth with organs and the systems. Basically for that we used the Rye-Hold-Vol system, who created this dental microsystem which connects the teeth with our organs. However, I've always wondered and wanted to comprehend how Dr. Vol built these correlations. Many people think this was already expected. In traditional Chinese medicine, however, it was he who created this correlation, and for that I wanted to understand how this was made. Associating dental groups, for example, incisors with kidneys and bladder, canines with liver and gallbladder, and so on. Nowadays, dental care already worries about oral problems, oral pathologies, influencing systemic health, but basically dentistry today is concerned with the microbiota, along with disease-causing microbes that come from the mouth for the organs and systems, thus yielded then the changes in these organs such as heart issues and diabetes. For the organs and systems, thus yielded then the changes in these organs such as heart issues and diabetes, respiratory problems, alterations in the gestational cycle, pregnancy, rheumatoid arthritis, metabolic syndromes, kidney problems, etc. Pathologies associated with oral contamination or infections that migrate to other points. For example, Fusobacterium nucleatum, which is essentially oral bacteria, but that it's oftentimes associated to the Alzheimer's, and its presence in the mind creates beta amyloid, or the same bacterium in the intestine causing cancer. So, this is really relevant, but it's still a very superficial aspect of this connection between teeth and organs. Connection between teeth and organs, and the opposite is also true. Alterations in the organs, such as excess in the liver causing halitosis or an increase in cortisol, causing bruxism associated with chronic stress, systemic inflammation causing or related to periodontitis, periodontal inflammation, you name it. So, nevertheless, you will see, especially in this second lecture, that seemingly healthy mouths can also be correlated to systemic alterations, basically because of the efficiency in chewing. If we have the ability to chew well, to grind food well, that's the first step towards our intestinal health and our general health. The Chinese say that we all should drink our food and that this would be the key to longevity. In other words, we are not what we eat, we are what we digest, and because of that, we need to be able to chew efficiently and be able to grind our food well. There are many forms of evaluation. There are standardized forms that we use in scientific experiments where you have a standardized element that is chewed, and then the size of the particles is measured so that we know if there is a chewing efficiency. This can be done, for example, with carrots. Doing so, we can comprehend and assess how this person is able to crush this food. And why is that? Because if we swallow food with particles smaller than 2 or 3 millimeters, the digestion time will be around 2 hours. However, if we swallow this same food and the particles, we fragment them to sizes larger than 3 millimeters, between 5, 6 or 7 millimeters. Digestion can take up to 6 hours. So imagine the food sitting in the stomach during that 6-hour period. Often we've already eaten again, and that food is superimposed on the other, and all this. It is up to the stomach and the production of hydrochloric acid to try to break down, fragment this food. And then we have, because of this situation, an increase in the length of time the food is in the digestive tract, especially in the stomach, causing fermentation, acid reflux, therefore alterations in metabolism that can cause systemic problems, starting with chewing. So much so that China uses phytotherapy, herbs, Chinese dates and ginger to stimulate stomach function, increase hydrochloric acid production, and improve digestion for thousands of years. And Chinese medicine. In the same way as acupuncture, they are founded fundamentally in the flow of energy and information through energy channels, the acupuncture meridians, as they are known in the West. And many of these meridians or energy channels are closely related to our stomatognatic system, to the mouth, as is the case, for example, the stomach canal, which has its initial trajectory overlapping the muscles of mastication, leading us to consider that proper mastication is essential, stimulus, adequate stimulus, so that this information helps digestive processes and control the entire digestive process. So things are all interconnected. However, other channels like the kidneys or large intestine, for example, also, although they don't have a direct path related to the mouth, have collateral vessels or collateral channels that connect these channels with the mouth, with the stomatognatic system. See the importance of the mouth. The tongue, for example, in Chinese medicine, in Qigong, connects the two main channels, the two main vessels, Tumo and Geimo, governor vessel and conception vessel, which we refer to as a minor orbit. Therefore, you can see the importance of the mouth in the energetic balance of the system. And if we take from the tips of the fingers to the elbow, from the tips of the toes to the knee, we already have a non-localized treatment system at a distance on the 5 elements of acupuncture. So, for example, if I want to sedate the lung channel, if I have excess of energy, lung is metal, and we know from the law of the 5 elements that water drains metal, silks metal. So the water point is the sedation point of the lungs channel or meridian. Therefore, the same applies to all the points of the ancient Shu system, which is between the hands and the elbow, between the toes and the knee, as if it were already a microsystem for treating all the imbalances in our body. However, when we talk about microsystems per se, these are more recent systems, such as the ear microsystem created by Nogia in the 50s, where we have the ear represented, a body, the head, spine, internal organs, with acupuncture points that we can also treat from a distance to rebalance or stimulate the body. The same goes for the feet. As you know, we use the Sujok, Korean micro-acupuncture system, to relate the fingertips to the organs and systems clinically, which were evaluated by Dr. Konstantin Korotkov. Well then, so let's not forget that in addition to the acupuncture points, the superficial tissue of these microsystems is also important. So in the ear, for example, we have bed sores, wounds, spots, nodules. We have an increased blood circulation or not, the decreased blood circulation. Thus, the state of these tissues and microsystems reflects the condition of the organs and systems as well. Therefore, similarly, the teeth are interconnected, as stated by Dr. Voll, with our organs and systems, and we can also assess imbalances through the state of the teeth and also carry out a treatment. Okay, in Chinese medicine, in the Linshu and Suen, it has existed for over 3,000 years, 4,000 years. We see passages talking about or the relationship between teeth and systemic health, but from the point of view of the 5 elements. The teeth, like the bones, are controlled by the kidneys. So when we experience a drop in kidney energy, we then have a weakening of the gums, a change in the condition of the teeth, and also the accumulation of bacterial plaque altering the microbiota. In other words, is mentioned in these canons of Chinese medicine, changes that occur in the mouth from a decrease in the energy of the kidney channels, but not specifically relating to dental groups with organs and systems, as was done by Dr. Voll. So we went to research how he made this relationship. Dr. Voll was a German doctor. He had bladder cancer and was discouraged. He treated himself with acupuncture and he was cured, he recovered. Then he fell in love with acupuncture and wanted to understand how this relationship, acupuncture points, worked with systemic health. He developed microamperimeters, which are nothing more than electrogalvanometers where we have a negative terminal that the patient holds and a positive terminal in the shape of a pen to measure the bioelectrical characteristics of the acupuncture points. Taking these measurements, he saw an oscillation, a measurement range in both voltage and electrical resistance, amperage, or frequency of these acupuncture points. Hence, with these measurements, he uncovered a truth. In total, there are 20 energy channels, including 8 new ones and the 12 main channels from acupuncture. He then used control points located on the hands and feet to make this energetic assessment of the patient. Hence, these oscillations, this frequency range, he classified into 3 bands. Therefore, from 0 to 100, from 40 to 60, he classified this range as normal, which was roughly shown around 5 microamperes, 870 millivolts, which would be the absolute point of the system. Below 40 to 45, he considered a declining state of inadequacy, and above 55 to 60, an inflammatory state of excess. So deficiency, degeneration, excess, and inflammation. However, he used 2 other techniques because when he measured the acupuncture points, even if that point appeared to have a regular level of energy, a normal voltage, and a normal amperage, keeping the pen on that specific point, oftentimes the channel didn't have enough energy to maintain this energy level constantly, and the energy would decrease. And then he found that by actively stimulating this point with a current of 1.2 volts, he was able, through a test, direct check from this acupuncture point the actual state of this point, contributing to the diagnosis. He also found that patients with specific diseases such as prostatitis, when he held certain substances such as echinacea, for example, so patients with prostatitis, when they held vials with echinacea, the state went from an inflammatory state to a normal one. So he verified the constructive resonance or destructive, acting as a stimulator or as a toner or a sedative of the points. Therefore, he then created a beehive where he tested each element to determine the normalization of the bioelectric state of the acupuncture channels and subsequent treatment of the pathology. With regard to the mouth, he used the lymphatic degeneratio channel, in charge of managing the lymphatic drainage system of the mouth, the teeth, the maxillary sinuses. So the specific point number 2 of the lymphatic degeneration system shows us the condition of teeth, maxillary sinuses, maxilla, and mandible. So every time he encountered bioelectric changes in this point 2 of the lymphatic system, he was then utilizing a sensor for his tasks and checked all the teeth in the mouth. And those teeth that had alterations, when those teeth had bioelectric alterations, he would indicate that tooth and afterward examine all the checkpoints of the hands and feet to ensure everything was, in order to see which point was altered, related to that tooth. Thus, knowing the specific diseases and the alterations in the points, he was able to connect each tooth with the organ and the system, thus creating the table you are acquainted with, which was utilized in the BioL system for connecting teeth to organs and systems. Therefore, then he developed a system where each group of teeth, in this case the incisors, are related to certain anatomical structures, such as, for example, cervical vertebra 5, cervical vertebra 6, cervical vertebra 7, and so on. He did the same thing with the canines, premolars, and molars, and also with the wisdom teeth or third molars. So he then created a table of correlations between anatomical structures, organs, and viscera, such as for both of the upper and also for the lower teeth. Researchers, including Colbert, have confirmed these findings regarding acupuncture points have a different bioelectric behavior from the placebo point from the non-acupuncture points around the point that the increase or decrease in resistance or electrical conductivity specific to each acupuncture point correlates with the clinical state or a specific clinical disease, and that the treatment of these alterations, these pathologies, restores the normal level or the normal bioelectric state of the acupuncture points, increasing or decreasing the energy level of these relative points. Other studies have also been evaluated, such as the one carried out in Georgia with more than 100 patients. This other one too, using 60 patients, in this case 50 patients with respiratory alterations, and 10 control patients. Master's and doctoral studies in the field were all evaluated. So we've summarized all these studies in this table so that in a very objective way we have listed 4 items to be evaluated. Do acupuncture points have a different bioelectric behave compared to the placebo points? Different from the non-acupuncture ones? Secondly, is the increase or decrease in impedance the bioelectric characteristic of these acupuncture points related to clinical pathologies with clinical situations? Third, does the treatment of these pathologies restore the bioelectric state of the acupuncture points? Does it normalize the acupuncture points? And finally, these acupuncture points related to these pathologies, are they related to the alterations proposed by Vol? So, in all the studies we checked, and we noticed a positive correlation based on all the analyses that confirm the results reached by Vol. We are in consensus with the Vol. However, we noticed that a few works, such as the one by Dr. Edna Ernst, she found no relationship. Didn't see any difference between acupuncture points with non-acupuncture points with placebo points. No significant, noteworthy in the status of with the bioelectric state of the acupuncture point, much less in the treatment of these diseases with rehabilitation or bioelectric restructuring of these points. So we wondered why, and then we can utilize the work done with Ryodoraku and our clinical experience also with Ryodoraku to understand this situation. Many times doctors often don't know acupuncture. They can't understand how systemic alterations can alter the bioelectrical condition of an acupuncture point, and by evaluation methods. Therefore, Ryodoraku, for example, is a very similar method to Vol's electroacupuncture because it uses microamperimeters for evaluate the source point assessment. And as a feature, these systems also have a negative pole that the patient grips, and the positive pole, which is a measuring pen, exactly like Vol's electroacupuncture, and which also requires a saline solution to improve contact with the skin. So the pressure of this pen, the angle of this pen, the contact area, and also the condition of the skin and the degree of humidity the saline solution provides, leading to important alterations in the system, especially when we do a research with different people, the work. Therefore, there is significant variation, depending on how it's used, how it is, taking contact with the skin. Hence, the system depends a lot on the technique used to take the measurement, calibrate the meter, and therefore we have a significant variation, mainly when we do a survey using different people taking the measurement or the same person repeating the same measurement. In comparison to the BioWell, we have been advocating for the use of a sensor for several years now. Also to make measurements of the acupuncture points using the BioWell and the sensor directly connected to the cylinder, and variations in the bioelectric state of the acupuncture point causes shifts in brightness, intensity, and area, and so we have measurement of a similar to the Dorako River for the source points with the use of the BioWell. When comparing one study with another, we checked that the standard deviation in traditional measurements with Ryodoraku is much higher than the variations from the BioWell system, mainly due to its measurement method, skin adaptation, and for not needing a negative pole, and also not need to hydrate the point with a saline solution. This project is really intriguing since it's a work which takes place in Uzbekistan, where acupuncture point's bioelectric state was evaluated during COVID, which showed an excess amount, with an inclination of inflammation over 60, as already said. And these measures, they adapted to corticosteroids, like dexamethasone, or the use of ribavirin, used as an antiviral substance. And also, surprisingly, with RNA polymerase nosode. The nosode is a homeopathic remedy where you only have the information and also managed normalize the bioelectric state of the acupuncture points. So, see what is interesting. The demonstration of the efficiency of a homeopathic medicine in normalizing the bioelectric state of the acupuncture point. This is a more recent work, done in 2024 by Dr. Federico Miraglia. And he had a very interesting idea, because already here, in the measurement with Vohl's electroacupuncture, we have a very large variation in measurement, a very large standard deviation because of the measurement technique. What did he think? I'm going to use a conductive adhesive on top of the measurement points, and then when I go to measure, I'm going to measure this conductive adhesive. I'm not going to measure directly on the skin, so I reduce the oscillation of the measurement and normalize the collection. So the results were positive and the technique proved to be efficient for the objective assessment of pathologies by measuring the bioelectric behavior of the acupuncture points, also using the informational system, which also gives greater accuracy of the results. Very well. In addition to the system of the relationship between teeth and organs and systems, this system grew with Gleditsch, subsequently suggesting a connection between teeth, which he referred to as an integrated system of the teeth, mucosa and periodontium. So the mucosa relating to each tooth is used for treatment through the application of substances, such as the use of anesthetic solutions without vasoconstrictors, like carbocytezin, for example, or the procaine employed in neural therapy, or even saline solutions that are physiological in nature, which, when applied to teeth that have alterations, produce non-local effects such as the microsystem, for example, such as the auricular system or the system of the feet and hands points, but also the retromolar region behind the last molar. In the same way, with all this in mind, we can use, for example, Lafouille's reflexology, who associated particular acupuncture points to homeopathic remedies, categorized according to the 5 elements of nature. As we know the dental groups related to the 5 elements, we can use this homeopathic system for the treatment of the systemic alterations, using the teeth as a reflex system for non-localized treatment. So let's dive into the physiology of the acupuncture point. We already know that the acupuncture point is a bioelectric structure, and measuring it with an electrical resistance meter, a ohmmeter, we see that the acupuncture point has a lower electrical resistance when compared with placebo points, non-acupuncture points. And also when we use radioactive substances such as technetium-99, and we inject this technesio at a point that is not acupuncture, it remains stagnant at that point, it does not dissipate. However, when we inject technesio at a specific acupuncture point, he goes through a specific channel, hitting the fascia. So, the acupuncture point and the energy channel can be mapped by radioactive substances. In the same way, if we use the needle shapes, specific angulation, vertical or angled, we can tone, and when we find this point of activation called Teiki, we manage to stimulate that acupuncture point mechanically so that I get a response. In the same way, Dr. Langevin in 2002 examined how the needles rotate to the right and to the left, absurd or in an effort to sedate or to tonify the acupuncture point being treated. And after testing on subjects, she finds that the point, after being stimulated, the spiral connective tissue. Then, through acoustic and Corstione ultrasonic microscopy, it was found that the acupuncture point became spiral, the tissue became spiral, modulating the flow of energy and information from the acupuncture point. These works were copied, along with all of them demonstrating or supporting this idea that connective tissue can be mechanically altered to control the flow of information and energy. This is also in accordance with Heike's work, which shows that muscle armor, the tensions, modulate the flow of information, just as scars also modulate the flow of information through the acupuncture channels, and can be treated in order to restore the physiological flow of energy and information. We shouldn't think of acupuncture points only in terms of connective tissue or fascia. So we have evidence that the nervous system is directly related to the acupuncture channels. Similarly to the circulatory system, the blood vessels are involved here. Electromagnetic conduction follows a similar path to the acupuncture channels, as does the flow of fluids in our bodies, especially the extracellular fluids. Therefore, we can understand the communication system or biocommunication as a biological unified system, a biological metasystem, thus representing a collective of structures, arteries, veins, nerves, lymphatic vessels, connective tissue, connecting our entire organism in an objective way through low resistance metachannels with high efficiency in biocommunication and energy maintenance. Currently, physics is getting very close to biology through the development research laboratories that they got today because advances in equipment. Considering then the presence of coherent states since energy is a very expensive currency for our system, it suggests that coherent states can raise efficiency on the usage of energy and specificity of information transmission by controlling a system composed of trillions of cells and which requires a system of high efficiency and high perfection to maintain homeostasis, making us think of quantum states or coherent states of control. The presence of quantum states are highly questioned, however. Research laboratories scattered all over the planet today, this area of quantum biology, especially with the development of new equipments, more precise equipments. Thus, coherent states, which Einstein referred to as ghostly states, like tunneling, quantum spin, quantum entanglement, quantum superposition, which it was expected to be found only in controlled, noise-free environments at ultra-low temperatures, hardly be present in hot biological systems for long enough to have a biological effect. However, with the development of equipment and research, initially in vitro and now in vivo, they prove that quantum states can be related to many functions or physiological processes such as photosynthesis, magnetoreception, the enzymatic reactions, tissue regeneration, brain dynamics of consciousness too, as it was theorized by Penrose in the past, and also bioelectric conduction through the acupuncture channels. So, currently, you can measure objectively, for example, the superradiance of intracellular microtubules. You can objectively measure intracellular molecules and evaluate, for example, photon emission or electrical conductivity. Crystalline biological structures in our bodies, such as long molecules, which basically function like liquid crystals, like semiconductors, they might be the base of the anatomical structure that conducts biophotons, excited electrons, protons, ultra-fast, connecting all the cells of an organism composed of trillions of cells. In this way, information connect from outside the cell to inside the cell using integrins, which are types of molecules able to transmit information to the intracellular microtubules, thus transforming our body into an integrated system of biocommunication in which we have the flow of subatomic particles at speed in coherent states, producing resonances and maintaining these biological states. So, these structures as demonstrated by the Bohan brothers, and after through primovascular system, are very similar to these crystalline biological crystals able to transmit information and energy in coherent states, such as, for example, solitonic waves, which are stationary waves maintained by resonance, and which may be trafficking coherently, maintaining the integration and homeostasis of the system. In 2023, we held a symposium in Brazil where Professor Korotkov and Dmitry Orlov also participated, and where researchers in the field of quantum biology took part, such as Nathan Babcock, for example, and they brought us the latest research related into controls or quantum states or coherent states of biophotons. And also, he replicated Gurdjieff's work, showing the control of biophotons in biological systems, such as cell mitosis, for example, and also superradiance within extensive networks of tryptophan, networks in biological architectures, and also projects like Anirban Bandyopadhyay's, which show that using cymatics, he managed to reproduce the structures of the microtubules through water resonance, showing an intimate relationship between the resonances of the microtubules with the nanomeric structuring, the nanomeric construction of these microtubules. Finally, the synthesis of tubulin respects, so constructed based on the resonance that is present as a flow of information within our organism, and changes in this pattern, interferences in this pattern, are the foundation, basis, the emergence of specific diseases or pathologies. During the month of May, Rick Sa and I released a study in the Explorer magazine that illustrates the crucial role of coherent states of biophotons, as well as the possibility of balancing entropy, biophotonics in emission therapies, cell structuring of connective tissue. It may be one of the answers to the holofractality of our organism. Microstructures that repeat themselves in fractal macrostructures. They form repeating patterns that give shape and characteristics of tensibility to the system in the transfer of resonance and in the transfer of information. Thus, this would be a base for understanding tissue layout in a fractal way, and it is repetitive and replicative, in which the micro is inspired by the macro. Structures mean larger structures. Hence, our organism would be represented in small systems like on the feet, hands and ear, in the eyes, mouth, teeth. Thus, the state, the micro's function matches to the macro's state function, not only for diagnosis and eval, but also for treatment too. In this way, we have the opportunity for assessment through the mouth, the eyes, the hands, and the feet. So, Professor Korotkov, evaluating with electrophotonic images of the fingertips, then created a relationship between specific areas of the fingertips with our organs and systems clinically evaluated in thousands and many people. The great advantage of the GDV technique is that there are hundreds and hundreds of scientific studies carried out demonstrating the scientific basis of this technique. Many writings by Professor Korotkov and several other writings by different authors demonstrated the core principles of biowell technology with images of electrophotonic effects visualized by the gas discharge. In Brazil, 5 theses already exist, PhD thesis. We are now starting the 6th one, PhD thesis, also at UNICAMP, as well as several literature reviews, providing a scientific science of bioelectrography, Korotkov standard. When we put our finger on the 5 volts coming from the computer are boosted with a Tesla coil leading to a voltage of around 5,000 volts that goes behind glass, and when touched creates an electromagnetic field. By touching this glass, we ground the field. Electrons are extracted from the fingers, ionize the air around the fingers, producing a glow. The glow is recorded via CCD, a camera which sends the information to a computer and are processed. So a dynamic event takes place, is recorded with a frame that is later painted, colored for the purpose of accounting and evaluation, intensity and area. In our system, as has been said, each sector is related to the system organ, and we have on the thumbs sectors 3 and 5 related to the maxilla and the mandible. However, in a non-specific way, we don't know which teeth. They are associated with certain organs and particular viscera. So, for example, when we have an excess or a deficiency in the teeth and jaws area, we don't know exactly which tooth and which jaw is affecting the organs and viscera, or organs and viscera, or vice versa. Thus, when we relate all the energetic levels of the organs and systems according to Voll's findings, we were able to create an evaluation system where we relate the specific teeth of specific sectors with organs and viscera. So, for example, here we have the incisors represented by the anterior, inferior, and anterior teeth, demonstrating the energetic condition of the organs and viscera associated with these teeth. Therefore, we can analyze every area of each tooth and associate them with the relevant organs and systems. We can check if the problem is oral or from the mouth, or if the problem is of systemic origin. So, due to an imbalance, we can see if there's pathological changes in these teeth, whether there are restorations, restorative materials, or too much occlusal force. We can do bioresonance tests with neural therapy, employing homeopathic drugs or procaine. We can also assess or relate the changes to head posture and the body posture. And we will also assess the chewing preference side along with the chewing function of this patient, as with malocclusions. Research is being conducted at universities. Here at Unicamp, we have 2 pieces of equipment acquired through funding agencies. Unicamp has 2 biowells, where we wrote that doctoral thesis. At this moment, we are about to embark on a new doctoral thesis focusing specifically on assessing the relationship teeth with organs and systems. This is a work in which they compared the parameters related to GDV in relation to the bioelectric characteristics of acupuncture points, like the electroencephalogram, heart coherence, and hormone levels checked via saliva. Therefore, the conclusion we have arrived at is that the outcomes produced by the GDV, gas disposal visualization, has a significant canonical correlation among these parameters and the neuroendocrine and immune parameters, along with the coherence of the heart and the electroencephalogram, showing the method's sensitivity for systemic assessment. Now, we are about to begin a work with 2,000 children of the public schools from Paraná Federal University, run by Professor José Vladimir Fonseca, where we will assess acute and chronic stress of the children from the public net compared to a validated survey, cortisol curve determined by saliva and also by biowell tests to the GDV tests. We will also attempt to link, if possible, to the data from the EEG and heart coherence. I would like to thank for everyone's attention and see you on the next lecture.